Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Renee Wiczorek. She's lead product manager at Truven Health Insights by Merative. Welcome, Renee.
Hi, thank you so much for having me. I'm excited to be here and talk about health insights.
Yeah, for sure. I'm excited to learn about health insights, even get a bit of a demo for those that haven't ever seen it. But before we go there, tell us a little bit about yourself and Truven Health Insights.
Sure. So I am a principal product manager at Merative, and Truven is part of one of the businesses at Merative. And our lead analytics portfolio includes health insights. And what we do and what I've spent most of my career doing is really helping health plans, employers, healthcare organizations turn all of their healthcare data into really actionable decisions. And health insights really enables our customers to do that.
I mean, to that point, like what are some of the challenges that health plans and employers really face today?
Yeah, I mean, they're all facing, in my opinion, a really common problem. It's, making really important decisions in a very, obviously increasingly complex environment. The healthcare costs are rising. Our employers are trying to deliver affordable benefits. They want to keep the employees that they have, the high performing employees. But they also want to help them keep their health and improve their health. The health plans are balancing member outcomes, all the regulatory requirements, network performance, and affordability, and everybody has to demonstrate value. That is the big thing. So, the big challenge with that is really not the data necessarily, but it's all the clarity that you have to find within that data. They can tell you what happened, but they can't always tell you why. And so that's really, I think, a big challenge that continues. And with some of the introduction of more technical capabilities like AI and those sorts of things, it's really about how to make sure that you are taking all of these different things, the dashboards, reports, spreadsheets, vendor analyses, all of those things, and really start to use that to actually answer questions and find that clarity in your data.
Interesting. I mean, to that point, health plans and employers have a lot of data. Maybe too much data, I've heard some people say, but how many of them are really using it effectively? And tell us, like, what does it really take to get value out of that data?
Yeah, I mean it's a great question because having data, right, and using it are two very different things. And so, they've got, like you said, a lot of data. They have eligibility data, pharmacy, medical, wellness, all the different data from all their vendors. And yet they still struggle to answer basic questions like what's truly driving a cost increase, which programs are working, which populations need attention, where should we focus resources? So really what we want to make sure is you want to know what questions to ask before you open up a report. And so making sure that you have the most important opportunities identified that you might not have known that you should be looking for. And so it's really not about just better reporting, it's really finding what matters. And so we're really focused on, having trusted integrated data. We've been known for that for a very long time in the industry. Making sure that you have healthcare focused analytic methods and benchmarks, and then really a process for translating all of that data into action. And then as you have those three things, you start to get more of a decision-making advantage than what you might have today.
That's awesome. Could you share some examples, you've seen where the right data approach using Truven Health Insights has led to, improved outcomes or better outcomes?
Yeah, I think, the most common examples tend to be, where they see a trend, but they don't really know whether it's actually a problem, right? You might notice, we all notice rising healthcare costs. But the question simply isn't, cost went up. It's really what's driving that increase.
Mm.
How unusual is it? Is it unusual? What should we be doing about it? And so using something like Health Insights, we have relevant benchmarks through our market scan benchmarks. You can compare results against that. And so that helps them understand, is it a problem that I should be digging into? We also support, a lot of methodologies as far as looking at conditions, your episodes, your services, the different populations, and drilling into those factors to understand what's contributing to that change or that trend. So you can really target your interventions where you're most likely to have impact. And a lot of, another big use case is program evaluation, being able to use match cohorts to understand how you are looking at, one population compared to the next to really understand if those investments are actually delivering value.
Wow. Yeah, I'm interested to see this. So let's go ahead and check out a demo of Truven Health Insights in action.
All right. Thank you, John. I'm excited to show health insights and how our customers use the product and how, we've got users using the product with all the different offerings and different things that we've got within health insights. As you can see, we've got a lot of dashboards that we have available for our customers to be able to find information. All of these dashboards are configurable, so we're able to make them and tailor them to what our customers need. But what I really want to do is start to talk a little bit about how you will actually use the product and how our customers are using this information. And I'm going to start with our episode trends. Many organizations really begin with overall trend metrics, and the problem is that the trend alone, doesn't tell you what to do next. So we want to see what's happening to costs today, what's driving these changes, and how can I try to mitigate some of that? And so if you see the first tile here, you can see that my trend is up 10% over the previous time period. So you can also see how that compares to our book of business with our market scan benchmarks. So if this was 0, you would mean that your experience was in line with most others. Instead, we see that you're a little bit above this age, gender adjusted market scan comparison. So instead of sort of just saying, is this good or bad, you can really quickly determine whether this is an area that you need to act on. And you'll see these key insights everywhere within the product. They're easy to understand. They're comparisons in the first line of every standard dashboard that we offer. And in addition to looking at an overall trend, users can quickly isolate which population that they want to actually see that might be driving trends. On the right-hand side there, you can see we've got a set of filters that are configured for our users' needs so that they can see things by particular regions, employee types, states, these are all configurable so that they're able to understand that so that you can adjust and automatically adjust to those particular segments. And so what we want to do is really start to drill down. And I'm going to pause here at this, which conditions are driving costs year over year. And what this is going to be is that you can see we've got diabetes and we've got breast cancer, among others, that are the episodes that are driving cost. Now, what our users are trying to do is understand, again, how these things are driving things within their environment. And so we've got a lot of actions that users can do. They can drill up and down into different levels. They can go to patient lists, but I'm actually going to look at cardiometabolic conditions. And this is obviously something with GLP-1s, something that's really relevant today. And so you see this population, and you can start to see, again, very similar information, but really focused in on that particular population. And our users are really interested in these sorts of things so that they can find answers to those types of questions. We know these conditions are correlated with GLP-1 use. So I have a filter here that lets me look at, people with or without. I can also see the different conditions, so similar conditions to what we saw before, but these are very focused on this. And these types of analytics give me a really clean, easy way to understand the outcomes and cost impacts associated with GLP-1 use, which again is very relevant today. And we do this a lot for a lot of different of those high cost conditions. And so this is one simple way that we really use these kind of cohort populations to view information and help our customers understand what's driving trends. Another area is in really understanding where should we intervene next. So looking at the risk of rising costs. And so you can see with the Health Insights system, the core value is really in all the intelligence that we build into the system. And so the risk of rising costs is no different in that it allows you to really be able to start to think about where there's opportunities, and that's through these predictive models. And so we're really excited about this model. We just released it earlier this year. Clients, are always asking all the time, like, what does the future look like? How do I know what's going to happen? And this model helps identify upcoming risk at the individual level, and then offer that clear view of what's coming and not just something that's retrospective. So being able to understand this, we're able to really look at who's at risk for high costs over the next 6 to 12 months. And so we're really excited about being able to use this kind of level of information. And what's really powerful about this model is that it's not just flagging someone as high risk, it's also telling you why. So you can see over here, we've got the service types that are driving it, and what are the general drivers of that risk. And so these are really, I think, really helpful for our users and our customers to be able to understand, where that risk is coming from. And so with respect to the dashboards and the different types of capabilities, we also have the ability to dig into the detail and run really advanced reports that are easy for our users to find using a measure catalog, and being able to really look at all the detail around and really get down using our cohort builder, build a cohort that looks at exactly the types of populations that you want to be able to look at. So not only does the dashboard answer all of those key questions and give you a lot of key help to be able to get from a high level down to a detailed level, you also have capabilities that allow you to really dig into the different populations and start to specifically focus in on and zero in on different populations. The last thing I want to talk about and is something that we've got coming, which is in the generative AI space, and we're really excited to start to introduce that to our Health Insights customers. It's something called Insight Edge. And it's bringing these generative AI capabilities to Health Insights by allowing these business questions to be able to be answered and focused from our subject matter experts. So for specific topics like GLP-1, our subject matter experts who have multitudes of years of experience across our analytic consulting group are able to really focus in on what are the things that you should be looking at for specific topics, things like GLP-1s, cancer, MSK, looking at site of care, looking at high cost conditions, other things like, that you really want to be able to look at high cost claimants. Those are the types of things, and our subject matter experts are taking their experience to be able to look at what you should be looking at using AI to help deliver that message in a really nice formatted way that we're really excited about our customers having access to. And then extending upon that AI usage in a responsible way to ensure that we're not just slapping a chatbot on top of our database. We really want to make sure we're doing very responsible, but very impactful and providing a lot of value to our customers. So risk of rising costs is an example of a model, whereas Insight Edge really allows us to start to utilize AI and machine learning and be able to make that and deliver that in a really nice consumable way for our customers. And so when we talk with our healthcare organizations, we do see these challenges with respect to just transforming the data into more actionable, defensible decisions. And so we're really excited about the things that we can offer through our models, through our market scan benchmarks, and then through some of our innovations in AI with Insight Edge, and really excited about being able to offer that to our customers.
Awesome. That was a great demo. Thanks for showing us that. Where can people go to learn more about Truven Health Insights?
Oh, we're really excited to talk to anybody about Health Insights within Truven. And you can go to our merative.com website to find more.
Awesome. Thanks so much, Renee. I appreciate you sharing this and giving us a great demo of all the work that you all are doing to help employers and health plans. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Renee.
Thanks.